let me introduce Dr. Morris to you, and then she's going to present before our panel discussion, which should also be, shall we say, very stimulating. Theresa Morris is Professor of Sociology and Women and Gender Studies, Presidential Impact Fellow, and coordinator of the Women's and Gender Studies program at Texas A&M University, where she conducts research on gender, reproduction, and birth. Her first book, Cut It Out, The C-Section Epidemic in America, was positively reviewed in several venues, including the New York Times. And her second book, Healthcare in Crisis, Hospitals, Nurses, and the Consequences of Policy Change, received an honorable mention for the 2019 Adele E. Clark Book Award. She has also published articles in journals including American Sociological Review, Birth, Social Problems, and Women's Health Issues. Dr. Morris teaches graduate and undergraduate classes covering reproduction and birth, gender, gender and health, and medical sociology. Please let's welcome Dr. Morris.
Well, I would first say good afternoon to everyone, and a special thank you to Dr. Valerie Hudson for inviting me to be part of this. I'm very happy that we found each other on the campus because I feel like I'm probably the most fortunate speaker here today because I can call Dr. Hudson my colleague. So that's extra special for me, and I'm really honored to be a speaker at this just wonderful symposium. I feel like I have just learned so much and thought so much about kind of the role of women in all of these issues that are just not clear and are really underappreciated. So I want to talk today to you about why there are so few babies being born. And this is something that I just wanted to mention. We've seen overlap in all of the talks, and I see overlap in what I'm saying in other talks. So I can't promise to mention every time I see an overlap. So I just want you to know I've seen all of the overlaps, even if I don't mention it. But most of all, Dr. Shuba talked about why women don't have as many babies in the US as you might expect. But that's specifically what I'm going to talk about today. So I'm going to give you some data and some different ways to understand this. So first of all, these figures are fertility data from the United Nations. And the figure on the left shows the crude birth rates and crude death rates of the US. These indicate the number of live births or deaths per 1,000 mid-year population. And the figure on the right shows the total fertility rate, which is what we've more focused on today, which represents the number of children that would be born to a woman if she were to live to the end of her childbearing years and bear children in accordance with age-specific fertility rates. And so what you see is that they're going down, right? These rates are going down. And that's kind of the bottom line. As a social scientist, and I'm not the only social scientist in the room, and I think we've been reminded of this throughout the day, is just to remember that these rates are the aggregation of the decisions of individuals, right? So individuals make decisions about childbearing. And so to understand fertility rates, we have to understand how it is individuals make decisions about childbearing. And this is really kind of the grounds of a feminist analysis. Men and women are making decisions, and I'll talk a little bit, there is some data about who's making decisions about babies. But women, I would argue, have the largest role in deciding how many kids to have, whether or not to have kids, and then how many kids to have. So I think, can I do this on a click, do you think? Nope. I should probably. What I would like to, I'll just introduce it. The right to decide if and when to have children and to raise them in a safe and healthy environment is what is a human right, and that's a claim at the base of the reproductive justice framework. And I'm going to let Loretta Ross, who is a 22 MacArthur Fellow, introduce the reproductive justice framework.
When it comes to reproductive justice, if you start with the pregnancy, you're starting at the wrong place. You have to start with what's going on in the person's life before they're pregnant. My name is Loretta Ross, and I'm a reproductive justice and human rights activist. I was one of 12 Black women who helped create the term reproductive justice when we spliced together reproductive rights and social justice, because there were social justice issues prevalent in a pregnant person's life long before they even knew they were pregnant. Because if they had housing insecurity or fear of losing their jobs or fear of violence in their lives, that would determine whether they would keep an unplanned pregnancy or not. Now, in short, reproductive justice has three basic principles. Every human being has the right to not have a child and use birth control or abortion or abstinence if that works for them. And we have to fight for the right to have the children that we want to have, and that's the second tenet. And it spawned a whole movement called birth justice, which is to control the conditions under which we have children. And then the third tenet is once the baby is born, we fight for the right to raise our children in safe and healthy environments. Now, 10 years after 1994, the LGBT movement added a fourth principle about bodily autonomy, gender identity, and sexual pleasure. I'm not surprised that reproductive justice emerged out of Black women's reproductive experiences, because when we were kidnapped from Africa and brought here to breed as a wealth-building strategy for capitalism, then our children were prized. But that same womb product became problematized and criminalized after slavery. I'm really invested in people seeing their entire world through the human rights framework, because it doesn't matter what economic or social system you live under, because if it protects your human rights, that's the system you need to work to build. If it violates your human rights, that's the system you work to deconstruct.
I share this reproductive justice framework as a way to help us understand how women make decisions about childbearing, that the trends as an aggregate of women's decisions, and also to remind us, and I have taken a side on this, that any discussion of fertility trends should not forget that decisions around childbearing are a human right. It is also important to contextualize fertility rates against ideal and intended fertility, which tell you more about how many children people want or intend to have, or the ideal family size. This is drawn from an article in The Atlantic by Derek Thompson, Why U.S. Population Growth is Collapsing. The current fertility rate gray is a forecast of fertility completion from women turning 15 that year, if age-specific birth rates are stable during her life. And the completed fertility, that's the black line, reflects an estimate about how many kids a woman turning 15 in a given year actually ended up having. For more recent years, those women have not completed their childbearing, and so the values are forecasts. The ideal and intended fertility rates, so those are the orange and the green lights, are based on survey data asking women how many babies they want to have or what the ideal family size they would be. The point is that the intended and ideal fertility rates are higher than the current and completed fertility rates. So then the question is that gap, and that's what Dr. Shuba talked about. Why are women not having the number of babies they want or intend to have? This presentation will consider many issues that individuals considering about having a baby may consider, but before moving on, I think it's important to note that half of all pregnancies in the United States are unintended. So for those that are intended, both men and women typically are involved in childbearing intentions. Duvander et al. Had an article, Who Makes the Decision to Have Children? Couples Childbearing Intentions and Actual Childbearing. And they found that in general, both partners need to intend to have a first child for the couple to do so, but that the woman's intentions tend to have much more influence over the decision to have a second or third child. Right? And because of women's influence over second and third births more than men's, some of my explanations for this gap focus specifically on gendered phenomena that affect women. But also remember that the explanations I offer today affect both intended and unintended pregnancy. Remember, half of all pregnancies in the United States are unintended. So it's not people deciding whether they're not they're going to get pregnant. It's deciding whether or not they're going to carry that pregnancy forward. So intention, whether to get pregnant and how many times, this is for people who planned their pregnancy. Unintended pregnancies, though, have intentions on a decision about whether or not to carry that pregnancy forward. So let me start on my reasons. Now, I'm grouping this in terms of reproductive justice framework. Remember, the right to have a child, the right not to have a child, and the right to parent the child in a safe and healthy environment. So when we think about the right to have a child, the right not to have a child, people are thinking about lots of different things. One of the things they're going to think about are the costs. Women who give birth incur almost $19,000 more in medical costs than women who do not give birth. Although insurance pays the bulk of the cost, women on average pay $3,000 out of pocket for giving birth. Now, let's contextualize this. The 2021 median household income was $71,000. A $3,000 expense is about 4% of that median income. Further, according to the Federal Reserve in 2020, 35% of adults would not have been able to pay an unexpected $450 expense completely with cash. In short, a $3,000 out-of-pocket expense is not small change for most families. And planning for such expense then would seem wise, $3,000. Well, the problem is that how much one will pay for childbirth is really hard to predict. Kaiser Permanente found that the same mode of delivery can have widely different costs depending on the hospital. An uncomplicated vaginal delivery ranges anywhere from around $3,300 to over $37,000, and a cesarean section ranges from $8,000 to $71,000, right? And then the child has to be raised, and we've already heard about that. The U.S. Department of Agriculture estimates that adjusting for inflation, that today that would be, to raise a child to 17 years, would be around $300,000. And this includes the cost of childcare, which on average comes to $11,000 for one child per year. Let me say that again, $11,000 one child per year. But that ranges from $5,400 in Mississippi to almost $21,000 in Massachusetts. I'm going to bring abortion into this. Remember, because half of those pregnancies are unintended, and women are deciding whether they're going to have that, carry that pregnancy forward, or have an abortion. According to data presented in a paper by Lawrence F. Feiner and colleagues, 73% of women in their study indicated they were seeking an abortion because they couldn't afford to have a baby right now. All of this suggests that the costs associated with having a baby and raising a baby helps us to understand why women don't have more babies in the United States. But beyond the cost of having a child, there is a general issue with just financial strain besides just that specific cost. So let's start with student debt. Student debt in this country is at a crisis level. I think we've heard that. According to Forbes, half of all college students leave school with debt. The current level of student debt in our country is $1.75 trillion and averages almost $30,000 per borrower, which could go towards a down payment of a house, which could buy a vehicle. And according to data from the Federal Reserve of St. Louis, the average new home sale of a house is now over $500,000. That has increased steadily over the last 45 years. And with this great expenses, however, we have to understand that women are paid less than men. The female to male earnings ratio is currently 83%, which means on average, women earn 83 cents to every dollar a man earns. In fact, women had to work all through 2021 and then through all of 2021 through March 15th of 2022 to earn what men earned in 2021. That means that women work 15 and a half months to earn what men earn in 12 months. And you guessed it, and from what we heard today, mothers are penalized even more. Mothers typically are paid only 71 cents for every dollar paid to fathers, which translates into a loss of $16,000 annually, according to the new National Women's Law Center analysis of census data. The motherhood penalty exists for mothers at every educational level and for women of all races and ethnicities. And we cannot ignore our high rate of imprisonment. And I put this in financial strain because it belongs in several places. This high rate of imprisonment we have takes men out of the reproductive pool during their fertile years. The U.S. has the highest incarceration rate in the world. In fact, about 25% of the world's total prison population is in the U.S., which in 2020 had 2 million prisoners. That's a 500% increase over 40 years. 93% of inmates are male, and the majority are 40 or younger, right? So these men are not reproducing. Beyond the cost of having a child is the labor of raising a child, and this is something we heard quite a bit about today. Women handle the main household tasks and child care in the United States. In fact, in a study by the Gallup in 2019, for day-to-day chores of laundry, cleaning the house, preparing meals, and caring for children, the majority of respondents answered that women are more likely to perform these chores. Data from the same survey finds that only for the less regular chores of yard work and keeping the car in good condition do a majority of respondents indicate that men are more likely to perform these chores. This all adds up to what Arlie Hochschild terms the second shift. She studied dual career households and found that factoring in paid work, childcare, and housework, working mothers put in 1 month of labor more than their spouses do every year. So in other words, working parents, especially mothers, have 2 jobs, and they feel the strain. A study by CLEO, which is an organization that advocates for working parents, found that parents in the United States are losing a cumulative 720 million hours each week to stress and anxiety and caregiving, with women losing 49% more than men. Further, 1 in 4 are considering finding a new job to better accommodate their dual role as a working parent. And these struggles are well documented in a book, Women Don't Ask, which focuses on women's lack of socialization to negotiate in the workplace, but also focuses on how women are disadvantaged because of a typical lockstep career pattern that imagines an unencumbered male worker whose only focus is his career because he has no family responsibilities because his wife is at home taking care of everything. He doesn't need flex time. He doesn't need to leave early. He doesn't need to take children to school. The reality is that that worker doesn't exist for women, and actually for most men too. According to the Pew Research Center, over 60% of women with children under 3 are in the paid labor force, and that percentage rises to 73% for women with children under 18. In other words, a majority of families with young children do not have a stay-at-home parent, right? They are not unencumbered workers. And how do companies help with this, right? Well, the latest splash that we've seen, it's actually been a few years, but still, they pay for egg freezing, led by Apple and Facebook. I question if this is the best way to help women balance having a family with a career, given the many problems and uncertainties with freezing eggs. I kind of think, what about flex time? What about part-time work? About easy entry and exit into the labor force or part-time positions? I don't think egg freezing comes to the top of my list of helping women. Further, the U.S. is only one of 6 countries that offers no national paid parental leave. Right? Is that embarrassing, or is that embarrassing? And women in our country face a maternal health system in our country that routinely fails them. I'm a reproductive scholar. Well, I'm a reproductive scholar. I'm a scholar of reproduction, so I can't not mention this. The U.S. maternal mortality rate of 23.8% per 100,000 women is triple that of Canada and France, 16 times higher than Norway and Finland. We know that Black women face 3 times the national maternal mortality risk as white women do, and that our maternal mortality rate is going up. Women, kind of are coming into this system. It might convince someone that she doesn't want to have a baby in the United States. Obstetric violence is also a real problem in our country, defined by Attorney Farah Tella Diaz as bullying and coercion of pregnant women during birth by healthcare personnel. It's an epidemic problem. Vedum and colleagues in their article, The Giving Voice to Mothers Study in Equity and Mistreatment During Pregnancy and Childbirth in the United States, found that 1 in 6 women who completed their survey experienced 1 or more types of mistreatment, including being ignored, refused, receiving no response to requests for help. And these stories spread through social media. I challenge you to Google obstetric violence and see what you find. Advocacy groups such as Birth Monopoly have really publicized this, such that many women including many young women, hear about the mistreatment of childbirth. Does that affect if they want to have kids or not? There are also maternity care deserts in our country where there is no or limited access to maternity care. According to the March of Dimes, this problem affects and this is March of Dimes report, affects 6.9 million women and almost 500,000 births. Further, families that need infertility treatment to obtain a pregnancy will likely not have insurance coverage for that. And it can be very expensive procedures. Only 20 states have passed fertility insurance coverage laws, and only 14 of those laws include IVF, probably the most common type of infertility treatment. The cost of infertility treatment can run into the tens of thousands of dollars, and don't forget that infertility may be due to environmental contamination. We also have to remember that LGBTQ individuals may need help with infertility it's with fertility, it's not infertility necessarily, fertility to create biological families, and they may not have insurance coverage, right? And we also can't ignore the assault of women's reproductive autonomy that has been mentioned already by the Dobbs decision. Women are worried about losing control and requesting to have tubal ligation. Do you all know that? According to a CNN article, Dr. Franziska Hendok is an OBGYN in Rochester, New York, and she shared a list of 1,000 doctors who provide sterilization to services regardless of a patient's age or marital status. And she has social media platforms to educate people about tubal ligation. And I'm going to show you one of her TikTok videos. But what the study documents, or not study, the CNN article documents, is that OBs are experiencing increasing requests from young women who want to have their tubes tied, have tubal ligation, because they're very concerned with the Dobbs decision that they will unintentionally become pregnant and they don't want to have a baby. So this is a really fun TikTok. I think maybe I can do that on a click.
Really fluffed up week. Are you having a hard time finding someone who will tie your tubes for you? Here are a couple of things you can do. My first recommendation is to go back to your OBGYN and discuss your wishes. Make an appointment specifically to discuss your desires for tubal ligation. Let your physician know that you've thought about this and you are certain you do not want any more children and that you really would like a tubal ligation. Your doctor would not be doing their job if they didn't explain to you all of the other options, but ultimately it's your decision if you want your tubes completely removed and you don't want any other forms of birth control. If that doctor is still hesitant, ask your doctor to refer you to another physician who will be more likely to perform the surgery for you. If that doesn't work, I suggest going on the Child Free Reddit forum. They have a whole list of physicians across the country who are willing to perform a tubal on any patient. Doesn't matter how old you are, how many children you have, your relationship status, there's a whole list of physicians who are willing to help you. And if you still can't find anyone, leave your location in the comments and I'll help you.
And finally, the third tenet of reproductive justice about the right to raise children in a safe and healthy environment. I would suggest our country doesn't do a very good job at that. We can't forget that individuals exist in these environments. There are individuals who have decided not to have kids to be green. We just heard about this from Ann Crittenden. Lisa Hyman's, I'm just going to read this because it's so great. She's an editor at The Guardian. She explained her view. Population isn't just about counting heads. The impact of humanity on the environment is not determined solely by how many of us are around, but by how much stuff we use and how much room we take up. And as a financially comfortable American, I use a lot of stuff and I take up a lot of room. When someone like me has a child, watch out, world. Gear, gadgets, gewgaws, bigger house, bigger car, oil from the Mideast, coal from Colombia, coltan from the Congo, rare earths from China, pesticide-laden cotton from Egypt, genetically modified soy from Brazil. And then, when that child has children, wash, rinse, and repeat. In hot water, of course. Without even trying, we Americans slurp up resources from every corner of the globe and then spit 99% of them back out again as pollution. She defines herself as a gink. Green inclinations, no kids. Others have very specific worries about global warming, both that children contribute to global warming and a worry that children will bear the impact of extreme weather events. We also don't do a very good job of keeping children in our country out of poverty. According to the U.S. Census, the childhood poverty rate in 2021 was 16.9%, but rates ranged considerably by state from 8.1 to 27.7%. For example, 3/4 of the 12 states in the South and the District of Columbia had child poverty rates of at least 18%. The lowest states are Utah and New Hampshire, the highest Mississippi, Louisiana, and the District of Columbia. Even more striking is the range of poverty rates in metropolitan areas, which ranged from 2.1 to, I'm going to say it, 39.2%. According to a report by the OECD, thinking about comparison to other countries, on many measures and compared to other OECD countries, although children in the United States live in families with some of the highest levels of disposable income, high income inequality means that children in our country live in poverty and at higher rates than average in OECD countries, which average 13%. And we have to talk about evictions. It's a very valid concern for low-income families. The Eviction Lab tracks evictions in 6 states and 31 cities. Since March 2020, they have identified over 1 million evictions, including 7,700 that happened last week. Matthew Desmond and Carl Gershon found in their article, Who Gets Evicted?, that a renter's likelihood of eviction increased with her or his number of children, net of socioeconomic factors, race, and rental payment history. Eviction affects families with children more than anyone else. And school shootings are terrifying to parents. There have been 40 school shootings in 2022. Before 2022, the highest number of school shootings with injuries or deaths was in 2021, where there were 34. There were 10 in 2020 and 24 each in 2019 and 2018. Do parents think about this? Do people think about this when they think about having kids? And we cannot ignore in the literature that suggests that Child Protective Services punishes poor Black families. In her riveting book, Torn Apart, legal scholar Dorothy Roberts documents how the child welfare system punishes Black families and puts Black families under state surveillance and regulations, which has the sinister effect of tearing Black children from their families and driving many to juvenile detention and imprisonment. Do families consider this when they think about having children? So I go back to the ideal number of children versus the actual number of children. And I ask today, why are these rates different? And I hope I've shown you some rates that intentionality may affect childbearing, both in the decision about whether to get pregnant and then how many children to have. And also for those people who have unintended pregnancies, 50% in the United States, whether to carry that pregnancy forward. And I want to give a special thanks to Beja Heron, who is an undergraduate student who worked with me on this presentation. She and I met at Blue Baker. We brainstormed about reasons why women might have children, not have children. And we came up with that list together. And she helped a lot with the slides. And she found that great video that TikTok, I'm not a TikTok user, so guess who found the TikTok video? And guess who told me this was on TikTok? And she also found that great video of Loretta Ross, and she put a lot of this together. And you can see all of the great things she is doing, right? She's graduating in May, public health, gender, and health minor. She has been accepted already to the McGovern Medical School in Houston for fall 2023, where she did an internship last summer. And she is going to be an OBGYN. Watch out. And thank you.
Testing. Can you hear me? Okay, thank you. That was a really great presentation. When you brought up the companies like Facebook and I don't know, was it Apple? It kind of made me ponder, maybe, has anyone ever thought about, instead of pushing for paid family leave, maybe instead asking these companies and pushing these companies to think about things like on-site daycare, nursing rooms, things of that nature, where we can have women, well, they're still getting paid, that's the idea, but also that they're still able to advance their careers. They're not taking those 2 years off, even though that's great, they're getting paid for 2 years, but they are missing out on promotions. So have we ever considered, instead of pushing for just paid leave, instead of trying the avenue of, let's make these companies more receptive of having on-site daycare and things of that nature?
I think those are great ideas, and I hope that you go and ask for those one day. I think that companies know these different things they can do. My sense is when they suggest egg freezing as a benefit, is that they think that they're doing what young women want. In other words, the biological what women confront biologically that's different than men is that women's ability to have a biological child is shorter, right? Because of their eggs, not their uterus, right? The uterus can have, you've seen these stories where women, who are 60 have a baby. Well, yeah, they had a baby because their uterus works. Those weren't their eggs, I promise you that. Right? Because eggs age out, not the uterus. So they're trying to directly confront this biological problem and saying to women, you can have it all, right? You can advance your career at the same time when really your reproductive capacity is dwindling quickly, right? The question is that the best way? And I think I agree with you. I don't know that that's the best way. One, it's expensive. That's why they're helping to pay for it. But there are known risks to this, right? Because to freeze your eggs, what you're doing is you're giving injections for your body to make a lot of eggs in 1 month. And then they have to be retrieved. It's not without risk. So I think they're trying to confront that, but I think the things you're talking about could confront it more. And also those easy entrance and exits could as well. Not having the expectation that you have to work super, super, super hard the first 10 or 15 years of your career, and then you'll have time for a baby. Why does it have to be that way? Right? Why does it have to be that way? So I think you have great ideas, and I'm sure these companies have thought of these things. My guess is it made a media splash too, right? Look, we're paying for egg freezing. We're putting thousands of dollars for women to freeze their eggs, right? But that's a great question, right? I hope that more companies do those things.
Hi. We in Dr. Hudson's Women and Nations class last week had a really lively discussion on C-sections. And I was wondering from your research what you found about why C-sections are being increasingly depended on in the medical field for women in labor. Thank you.
Sure. So I've written a book on C-sections. It's called "Cut It Out: The C-Section Epidemic in America." And actually, the book is almost 10 years old. I published it in 2013. But my research on C-sections is that our country does a really bad job of helping families who have babies who have some kind of birth outcome that is less than perfect, right? Whether it's due to a doctor doing something wrong, or there are sometimes just in the biological world, right, when reproduction doesn't work perfectly, and there may be something not right, that a baby may have some kind of a disability at birth. And so when, I'm trying to explain this quickly, right, when that happens, a lot of times doctors are sued for malpractice, not because the doctor did anything wrong, because a lot of these birth defects are very difficult to predict, and they're not due to medical error. But our country does a really bad job of providing medical care to people with disabilities. So if a baby is born with a profound disability, I question what else the family could do to get that pool of money that will be necessary to take care of the baby. Because just like we have this, this state system for so many things, we have state system for disabilities. Some states do a better job than others to take care of disabled people, but none of them do a perfect job, for sure. And kind of what goes into this is that, right, is that oftentimes, again, these are not predictable events. Sometimes they are, and I'm not saying there's not malpractice and doctors don't do things wrong that cause bad birth outcomes, but not nearly as often as they're sued. And so I'm not a doctor. I've been accused of being a doctor defender, and I say, well, they're for the most part, they're doing their job. I mean, I'm not trying to just defend bad doctors, and sometimes there is malpractice, and those doctors need to be held accountable. But oftentimes C-sections are because doctors are trying to prevent a bad outcome. The technology we have to monitor babies during labor and birth to see how they're doing is very rudimentary. It's not very good. A lot of people are really surprised at that, but it's really not very good. And so doctors have a hard time knowing if there's something bad is going to happen. But if there any kind of uncertainty, like the doctors watch the baby's heart rate on a fetal heart strip. If there's and a lot of times babies' heart rates don't look perfect all the time. Nobody's heart rate looks perfect all the time. Sometimes it's a little slower, sometimes a little faster, right? But doctors can't tell when that right is actually that the baby isn't doing well. And C-sections are a nice answer to that. Because they're not going to be sued if they do a C-section compared to a vaginal birth, typically in our legal system. So you see that happening. And it's just unfortunate. And I have to say, doctors don't say this, but I think that there's a general, we have to kind of see that undergirding the gendered issue to this is that there's little value on women's bodies and the integrity of women's bodies, right? To have that as an answer to a problem of an economic issue of I might be sued, right? So there the answer is, well, the baby's probably okay, but let me just like cut this mom's body open, right, her abdomen, and take the baby out and sew her back up, and that has solved my problem. And I think that we have to understand one reason we can do that. I'm sorry, I'm stepping away from the microphone, but I talk loud. One reason we can do that is because we're comfortable with that. We're comfortable with women's bodies being used in that way. And that's hardly ever discussed, right? So that's probably a long-winded answer, but I'm happy you asked it. And I'm so happy you're talking about C-sections in your class.
I know. I should be inviting you in for a guest lecture next semester on all of this. That would be terrific. I have two questions. One actually starts as a comment. I don't know if it's possible for you to get back to that graph about intended births versus...
Right.
Yeah. I couldn't help but notice as a data nerd that the gap between the green and orange lines are really getting out of sync. Now, if I understand the legend correctly, the green is what they would consider to be the ideal family size. And I note that even though that's dropped over the last several data points, it looks like it is either stabilized or even risen a little bit. But look at intended. Mm-hmm. Oh my gosh. So my first question is, what does that mean? My second question is a little more broadly, is that we just did this incredible natural experiment. What if we locked down whole societies and women worked from home? What would happen to the fertility rate? And so I guess I'm asking you if you've studied the data. I did see that is prompted by the fact that I did see that Iceland has had a baby boom as a result of the lockdown. But I don't know if that's generalizable beyond Iceland because Iceland is so strange in a number of socioeconomic dimensions. So 2 questions for you.
Yeah. So that is interesting. One of that might be a feature of the ideal fertility question. And in fact, in the Atlantic, the author of this article did mention that women were starting to more likely say whatever size you want. So yeah, so like a libertarian kind of individualistic. Well, so I think the question is like, what is the ideal family size? And it would be like whatever size the person wants. Like, what's the ideal family size? It's what I want. It's what you want. So the author mentioned that. So that may be part of that. So the question, I don't think the question changed, but that answer started to become much more prominent. So that may be a reflection of that, is my guess. That it's more you should get to decide what size you want. But yeah, but the intended is certainly going down. It's just not quite down as what actually the rate is. And I'm sure the intended is going down for all of the reasons of the gap, but also just similar reasons. It just hasn't. Their intended hasn't gone as far down as it has now. But I really think that that's partly that they're 2 separate questions and 2 ways to get at that. I think this is what I would think about the Iceland number, and I wonder if it would happen in the U.S. So this is just me not being a scholar of reproduction, but just kind of thinking about being at home versus being in the office. And I'm thinking it just gives a lot more chance for a baby to be conceived. Right, so if you do a natural experiment, right, like that everyone is home and everyone is working, I think there's just more chance for a baby to be conceived. I think that's what the baby boom is. So I think that would happen anywhere. That's what I think, right? But the question is, it would be interesting to compare Iceland to the U.S. and it would be interesting to compare the U.S. after abortion policy when you start seeing this, like would women be more careful? Yeah, for sure.
It's not really a question because I don't think it has an answer. But to connect what your question or the question you raised with the previous panel, I was wondering if there is another way to consider the impact of climate change that is not the conscious decision not to impact overpopulation, but more like a recession of the need to project our life toward the future. It is a very philosophical question, I understand, but does climate change affect our relationship with the future, and so also our relationship with reproduction? I guess that's an easier way to put it.
So with climate change, we're all thinking differently about the future. So it's almost indirect. You're talking about like an indirect relationship.
Yes, so I'm not thinking about it, but still, since I can't count of being able to assert my right to raise kids under the condition that I think are acceptable to raise a child, kind of that push toward the future.
Sure. I mean, I'm sure it can if you think about the future, definitely. And there may be other effects of climate that aren't direct too, right? If you live somewhere where you're hit by hurricanes more, you've been hit by a hurricane recently, that might directly change your plans to have a child. Or if you're unintendedly pregnant, you may be more likely to seek an abortion saying, my house was destroyed. I mean, how am I going to do this? So there may be other types of real direct effects of climate change in terms of weather events being more likely, right? And I'm sure, I have to admit I'm not a social psychologist, and so it's hard for me to think theoretically how that would work, but I believe you, right, that any way you change your framework of thinking can have all of these effects on, like a cascade down in terms of how you make decisions. So if you're thinking, you know, I don't think the Earth has much of a future, and I think it all might burn up in 20 years, right? I'm not saying what you think, but if one were to think that, then you might be like, I don't think I'll have a baby, like, and it's not a direct, like, the climate is causing this, but rather just, I don't believe I'll be alive in 20 years, so therefore maybe I won't do that, kind of that thinking. I'm sure it has to have an effect, right? And I also wonder, just more generally, what we're all experiencing in our society is just a whole lot of, division in our society, right? We see January 6th. We already see, President Biden says, when do we expect this to happen? The president to get up and he said, everybody should accept the midterm elections, or this is a problem, this is like a real problem with, not problem, but it's a wound to our democracy. I don't remember exactly how he said that. I mean, that's a big statement for a president to say, right? And so we're living in a certain time that has a lot of division. Could that affect what people are thinking, right? That this is, there doesn't seem to be goodwill in our society towards people who think differently than we do. And in general, that seems to be accepted, right? That we are on different teams. So I think there are lots of things that you could think that might have indirect effects for thinking of modeling this, quantitatively.
Good afternoon. I have just wanted to know your thoughts on, from a different context. I'm from Nigeria, and I'm thinking that even with the poverty that we have in our system, it's kind of very established that Africa's population would more than likely double before 2050. And it's not because things are working. It's just for the lack of education and just like women's rights and just access to healthcare and things like that. So you have people who are in a perpetual state of things not going on well, but they're not thinking in the lines of I don't want to have children. They're still populating and things are still going on as though things were normal. What are you saying to the kind of education that will be given to women over there versus women over here who are already thinking, oh, I don't want to have kids because I don't want to bring them into this kind of situation? So is there like a, what will work here versus what will work there?
Yeah, well, that's a really good question, and it's a bit out of my area of expertise. I'm a U.S. scholar, and I study the U.S., so I'm a little uncomfortable saying what will work and what won't. What I'll say is that reproduction is a human right, and I think women should be able to decide. Families, women and men, women make the primary decision, but men are involved as well, to decide how many babies they want given the context of their lives. And I think in order to make that in a way that is that they have the ability to do that, I think you have to have comprehensive sex education, access to contraception, access to family planning, access to abortion, right, to make those decisions. If you don't have access to contraception and family planning, then you're not freely making that decision, right? And so that's what you need for that human right. And that's what all countries have an obligation to give to the people in their country, is that. And I know it doesn't happen everywhere, but I also trust women very much to have the kids they want to have outside of a coercive relationship where they don't have that control. And there are some places there are families everywhere. There are women in every country, right, who were coerced into childbirth by partners. But that might happen more in certain contexts. And so I'm saying that I trust women, right, assuming out of that context of coercion and control, to make the decision that's right for them at that time. But at the same time, right, kind of we as a world owe it to countries to make sure that everyone else has a human right to live in a safe and healthy environment. And that means that we, as citizens of the world, owe it to everybody to not live in poverty, right, in every country, including our own, including in other countries. So that's like pie in the sky kind of talk. And sometimes pie in the sky talk is good talk, but it's not. I'm not giving you really good pragmatic answers, and I apologize for that.
Hello, thank you for your presentation. Is it on? Yep. Can you hear me? There we go. I really appreciate all the statistics you brought forth. I thought they were very interesting. The one that surprises me the most, although it really shouldn't be that surprising, is the cost of childbirth. I say that because as a woman in the military, I essentially have socialized healthcare. And I wonder, has your research examined anything about a difference in rates between C-sections in military women and military dependents and family members versus the average U.S. population, or is that something that you haven't looked at?
I haven't. I mean, the military is always seen as over here, right, for healthcare because of TRICARE. So I don't know off the top of my head what that price is. And again, those prices on the difference in the hospitals, right, that's not the prices people are paying. That's the price, right, that's charged to their insurance. Typically insurance or Medicaid. Half of all births in the U.S. are also Medicaid funded births or Medicaid covered births. So I'm not sure the difference, but certainly women in the military are going to pay much less out of pocket. It's that out of pocket expense that really hits families, right? Because they have private health insurance, but they come up with the average cost. Was that Kaiser? I can't remember who I got that average cost from, $3,000. So, but I think military, I don't know the actual cost, that variation. It probably is lower, quite frankly, because, I mean the cost, like what it costs to pay the surgeon and the hospital, and so there is a cost involved. You're not paying it, but I'm guessing that cost is also much more controlled. Part of it in the U.S., as you know, is this decentralized healthcare system that, it's kind of the Wild West, and so it's much, So it's probably the actual cost is much cheaper. Actually, what's paid to the, to the hospital surgeon and all of that. But yeah, that's a great question. I'm not actually sure. I'm not sure. Does anyone know about besides the free cost, like the difference? I'm looking at people who know the military, the cost of medical care versus outside. I'm guessing it's much less expensive because of the costs are controlled more, but I don't know that for sure. Good question.
Great, thank you. Thank you so much for a very informative talk. Just a quick question. If I'm understanding correctly, many of the reasons that you listed were hypothetical.
Oh, yeah.
Yeah, so I just was curious, do you have plans to research those, and or if you've sketched out future research that might be linked to testing some of those hypotheses?
Yeah, I mean, I thought about it for this talk because I it wasn't something I was specifically doing research on, like why women don't have babies. It was really kind of fun to sit down and use kind of, my sociological brain and Beige's public health brain to be like, let's think of all of the things someone might think about before they had a baby. But we might, and if we did that, we would have to, of course, have, a sample of women and ask. But we've talked about maybe we should do this, and who knows, right? We might, after doing the work of putting it together. Great question, yeah. All right, thank you.